Well, hello and welcome to all of our viewers from around the world. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at Gold Learning. Welcome to all of you joining us here today. We're talking about our Gold Midwifery Conference coming up here at Gold Learning, and I'm so excited. This is one of my heart just jumps out of my chest when I think about all the folks around the world that are passionate and care about the birthing field. So welcome to all of you listening today. We have a wonderful guest today. I have to say that out loud, Angel, because you and I have been working together for a little bit now. We've been doing some previewing and some of the content that you're going to be sharing. And I have to say, it was quite deep in my heart today. And I know you're going to share a little bit about that. But first of all, I would love it if you would introduce yourself to everyone listening in today.
Hi, Fiona. Thank you so much. So I am Angel Montfort. I'm a licensed clinical psychologist, and I specialize in perinatal mental health. I'm a mama of four, and we live in Florida, in the Tampa area, so kind of central Florida. I own a private practice, and so I mostly treat perinatal women who are struggling with either anxiety, depression, adjustment to motherhood, all of the kinds of things that can sometimes present during that postpartum period, especially. So I do individual therapy with them. At times I will lead groups and things of that nature. And yeah, that's kind of me in a nutshell.
Well, I have to say, just, learning, I mean, this area for me, I have to say, first of all, very passionate. We care so much about our families, and especially in that immediate postpartum. I think there's always that conversation that happens amongst professionals about why the information wasn't shared sooner. I know that we're going to be talking about that during your presentation, but can you tell me really what led to your focus in this particular area?
Oh, I love this question, Fiona, because I think for many of us in this field, the answer is very personal in nature when it comes about. And so I've always gravitated toward working with women and those who identify as women. And so I worked in a large hospital setting where I was the only psychologist on staff in that clinic that was a parent. And so often, our clients who were struggling with issues around parenting, postpartum issues, were sent to me with the assumption that I know it, of course, because I'm a parent. And what I saw pretty early on is that this is a really sort of specialized and nuanced area of concern. And so when you're dealing with postpartum issues, it's important to get additional training to really understand some of the differences between what might present as, for example, a major depressive episode in someone who is not postpartum versus someone who's 3-4 weeks postpartum. So it's important to know some of the differences in that. So I got really interested just in doing some trainings and kind of looking into it more and realizing, wow, this is this whole other field within psychology that I'm extremely passionate about. And also, I think one of the things that probably happens pretty commonly as well is that as you're studying new material, you're seeing yourself in a little bit of it. And I remember looking back and realizing, 4 kids ago, wow, it would have been great to know that some of these things that I was experiencing were not necessarily just to be brushed off as the baby blues.
Right. Yeah,
So,
absolutely.
yeah, pretty quickly I was just hooked and really fell in love with this work and really wanted to kind of get the word out there and tell as many people as I could that, hey, this is something that happens a lot and we need to talk about it.
Yeah, I mean, when we were working together today, I have to say that, yes, not only did it bring up a lot of these emotions as a mother of 5, and I'm like, oh, I wish I had known those things too, but many years have gone since then. I'm just so passionate now, like you, to make sure that the families that we work with get the information, because I'm sure like myself and you in practice, we see so many people come through the door who are just very lost, some of them quite broken because they just didn't know. And it comes as a surprise because of the juxtaposition of having this new baby, the joy, the love, and then the complete distraught feelings that they can have all at the same time. And so, I mean, you're not surprised, right? I mean, I'm preaching to the choir here, but are you surprised that it hasn't really sort of developed into other sort of, other professions? Why are people not talking about it in a normal capacity? Like, it should be part of everybody's, it should be on your desk, that you should be doing a screening every time you're in touch with families, right?
And I think so. I mean, I have to say, I do think that it's gotten much better.
Right.
Since, so for me, 12 years ago, having my first, it
Yeah.
certainly has gotten better. And I do see a lot more out there, even outside of our providers' offices, on
Right.
social media. That has just really blossomed
Oh,
in
yes.
terms of having a communities for moms and having
Yeah.
just parenting really struggles normalized. I
Hmm.
think there's still quite a stigma, and we're going to talk about that
Mm.
in my presentation as well. But there's often this stigma around, is it possible to hold both? I love what you're saying about, there can be this joy and there can be a lot of like pain and anguish
Hmm.
and stress that comes along with motherhood. And often I think we don't want to talk about that because it feels like there can't be both at the same time, and that,
Right.
one must cancel out the other. And that's just not true.
No.
I think the more that we can see perinatal mood and anxiety disorders as a complication of pregnancy, just like gestational diabetes happens,
Hmm.
and preeclampsia happens, and different things happen in pregnancy that we all understand might be a complication.
Hmm.
Um, it's not quite there yet. And I
Right.
think it's because it's tangled up with all of that other stuff about, well, what does this mean about me as a mother? Um,
Right.
yeah.
Yeah, sort of that self-identifying the thoughts of shame and failure, and not
Yes.
getting it right, can obviously develop, and we see it and we hear it. I mean, I talk to new moms every day. I'm also excited to hear about the development of how we engage the support folks around those moms, because of course we know, partners, dads, grandparents, and so forth and so on, can also equally play a role in supporting.
Yeah.
And so I'm excited to hear what you have to share about some of those things. Are you starting to feel like there's more community sort of coming together now? People are getting on board within the immediate family?
I think so, but it really depends on the family, and it
Hmm.
depends on the access that one has to resources, educational
Sure.
resources, all of those things. Because I think once and you and I just kind of shared that, once
Yeah.
and once you start to learn about this stuff, it it all makes sense, and you want to share that with other people that that might be entering into motherhood. So I think it's really just like getting the information out there and making sure that people have access to that information. Some of
Right.
that can be done, through us as we give our
Yeah.
clients material that they can share with their family and friends. But
Right.
I think even more than that, and I think that we're kind of moving in that direction of just having like a global conversation about
Yeah.
um, about parenting and about the support that is needed.
I do love that. It's so interesting that the field that we're in, I find, working with families, I find it doesn't matter where you are in the world, but folks suffer very similar things. So different cultures, different countries, different amounts of resources. You mentioned, some countries can be high in resource, some can be very low, and that can actually change no matter what country you're in, depending on your community, right? So
Yes.
depending on what's accepted. I find that very interesting. I find that, that's one of the things that has opened up for me personally, is just, being able to have that community online almost as professionals, right? We're able to
Yeah.
sort of, look at the latest research quickly and efficiently, that we're not waiting for so long to sort of utilize it. Let's jump into what the title of your presentation is, that you're going to be sharing with us here at Gold Midwifery, and it's titled Perinatal Anxiety: Options for Screening, Treatment, and Support. So you're going to be showing us, what are you going to be showing us in the screening area? Just give us a little snippet of what's coming up.
So regarding screening, we're going to be talking about how truly important it is to screen, especially for anxiety and OCD during pregnancy, because those
Mm-hmm.
are things that are experienced at a much higher rate. The onset is at a much higher rate during
Right.
pregnancy. So we're going to be talking about that and why it's important for not only mental health practitioners such as myself, but also any other, obstetrical provider
Mm-hmm.
that this patient is coming in contact with, because often they don't see me until much later.
Right.
And so we'll be talking through specific examples about how other providers who are interacting with them in any way can intervene and can ask the question, because often a question can be an intervention. You don't have to have any special fancy therapy tricks to be able to be in the room with someone and say, I know what you're saying, I know what that is, and
Right.
you can get better and you can get help with it, and here, let me put you in that right direction, as opposed to, feeling like, oh, I've never heard that before, and then
Right.
this client feels completely alienated. So we're going to be talking through, this is what it is. This is what perinatal anxiety looks like. This is how you can recognize it in your clients. And this is how you can then help them and empower them, and get them in the right direction for whatever support it is that they might need.
I love that, Angel. I think that, I feel like I've learned lots over the years, as a practitioner about the screening tools, how to screen and so forth and so on. But, I think that we should always be coming together to reevaluate this, because things change, things develop. There are nuances that, have been noticed, along, throughout the years, as I'm sure, you're aware. So I think it's going to be a fabulous opportunity to, again, look at what's new, look at what we might have missed, or just have new tools available to us, because that's what it's about as practitioners, right?
Absolutely.
Yeah, that's going to
Absolutely.
be wonderful. Well, I'm looking forward to this. I know it's not always an easy topic, to sort of discuss. And many of us, I think we were talking about being empathic today, so we take on a lot of those emotions, but that equally is important, to have those tools available to you as a professional. So this is going to be great to really dive into this topic and go over all those details again. So thank you so much.
Oh, you're welcome. It's been a pleasure. I'm excited.
Yeah, me too. Me too. And thank you to all of you listening in. If you've got any thoughts or ideas about this topic, or any experiences in your practice, that you want to know more about, you can drop it, in the comments below. And we're going to have a wonderful opportunity to actually sit down with Angel and ask questions during the live event. So I've mentioned this before, but don't forget, you can go to the website right now at goldmidwifery.com. That will give you more details on all the speakers that are going to be here as part of our Gold Midwifery Conference. And we'll look forward to you being able to join us for those live events. Now, if you're busy, and of course we know midwives are these days, don't worry. All the there'll be recordings available to all of you as well. And we'll look forward to hearing some of your feedback and engaging in our exclusive forums that we have available to all of you. Thank you so much to Angel Montfort for being here again with us here today. And of course, to all of you, our audience. Bye-bye for now, everyone.